You're listening to Health Professional Radio with Wayne Bucklar in our Health Academy series. Today my guest is Professor John King from the Multiple Sclerosis Clinical Trials Program at Royal Melbourne Hospital. John, welcome to the program.
Very glad to be with you, Wayne.
Now, John, most of our audience have a clinical background and will understand about clinical trials and multiple sclerosis, but I know there's some breaking news we want to get to, but can you fill us in for those listeners who are not familiar with it, what the Multiple Sclerosis Clinical Trials Program does?
Well, since 1993, we've been trialling these new drugs in MS patients at the Royal Melbourne Hospital, and this has been a terrific experience because prior to 1993, there was no treatment available. The first trial in 93 was of an interferon, which was quite successful, and then the first drug, betaferon, came on the Australian PBS in 1996. And since then, there were two more interferons plus Copaxone, and then I think Tysabri was next, followed by Galenia, Tecfidera, Aubagio, and more recently alemtuzumab. And all these drugs have been had their special qualities, some of them stronger than others, some with special side effects, but it's made a huge difference to the landscape for patients with relapsing-remitting MS.
Yes, it's the kind of disease that for a layperson like myself brings to mind a sense of helplessness and essentially not being treatable, but that's not the case anymore.
Not for the commonest form, which is relapsing-remitting MS. This about 80% of patients with MS or more present with attacks which come and go, and eventually lead to a build-up of disability if treatment's not started early.
Now, I understand from my notes here that it's Kiss MS Goodbye Month, and that's an opportunity to dispel some of the misconceptions and to ensure that people living with MS are talking to their neurologists regularly. What are the popular misconceptions about multiple sclerosis?
Popular misconceptions are based upon the fact that they see patients with disabilities in wheelchairs, etc., because these patients have generally developed the illness before the modern treatment era became available. So there's a misconception of inevitable disability. Another misconception is that young women can't have pregnancies, which is completely wrong. There are many other issues, but it does lead to problems. Untreated, of course, it leads to problems with employment and relationships and often mental health as well. So it's a very nasty disease untreated in many patients. Now, there is a small percentage of patients who have what's known as primary progressive MS, for which there isn't really very effective treatment. But at the moment, that's probably no more than 10%.
John, I understand that there's been a change in available treatment options that's just been recently announced. Can you tell us about that?
Well, there is a new drug called ZINBRYTA, or its scientific name is daclizumab, which has come on the PBS on the 1st of May. It's another drug in the armamentarium against the disease, and it's got a different method of action. So some patients who can't take some of the other drugs might find this is a better option. It's called a humanized monoclonal antibody that actually blocks a signaling pathway that sets off the multiplication of these pro-inflammatory cells. These are the T cells that damage the myelin on the nerves of the spinal cord or brain, and this drug blocks that pathway. So it's been extensively trialled and has shown to reduce the frequency of attacks and reduce the rate of accumulation of disability.
Now, am I correct in assuming that if it's on the PBS scheme now, people can get information about that just from their GPs and neurologists? They don't have to be involved in a clinical trial?
Oh, yes, it's available. I mean, GPs won't know much about it because it's just become available, and it has to be prescribed by a neurologist initially. So most patients with MS will have their own neurologist.
Yes. Yeah. Worth asking the question if you're not happy with your current regime, I presume.
Yes.
Now, John, as I mentioned at the outset, most of our audience are clinical in nature. As a result of having heard you today, is there a particular message you'd like to get across to them?
Well, one of optimism, I think. I mean, we often hear that the patient has been told by somebody, a doctor or a nurse or an allied health person, that, the outlook's bad. Well, that's not the case now. So one of optimism, and the other one is prompt early treatment. We know that our drugs work best in the early, what's called inflammatory phases of the disease. Mm-hmm. Once there's extensive damage done, nothing can be done to reverse that. But the vast majority of patients with the early relapsing-remitting MS respond well to the new drugs.
That's a good message to get out there, because early on is something you can never fix up later, is it?
Well, these days, the diagnosis can now be made very early with MRI scans. A typical clinical presentation with even a single MRI can make a diagnosis of MS.
Oh, really?
And our PBS is lagging a little bit behind in terms of availability of drugs. We're hoping to rectify that as well. By that I mean the PBS requires two attacks, two clinical attacks before a diagnosis can be made. But scientific trials have shown that the treatment onset with the first episode in patients whose scans indicate they have MS do better than those where the treatment is delayed.
Mm-hmm. John, it's been very interesting talking to you today. For people who have just joined us, you've missed my conversation with Professor John King from the Multiple Sclerosis Clinical Trials Program at Royal Melbourne Hospital. John, for people who want to get more information or get hold of you, is there a website they can go to, or is there some connection they can make?
No, I think, I haven't actually looked at Google what it's got on ZINBRYTA or the MS,
right.
MS Australia website will have information. This particular agent is made by Biogen. Their website will have information.
So lots of places to go looking on Google.
Yes, yeah.
If you've just joined us, my conversation with John about the MS clinical trials and ZINBRYTA is available on our archive. You can also get it on YouTube or on SoundCloud if you've missed our conversation. John, I do appreciate your time this morning. It's been a pleasure having you with us.
Thank you very much, Wayne.
This is Health Professional Radio. My name is Wayne Bucklar.